diabetes can take a serious toll on your feet, from nerve damage to circulation problems. Optum Care podiatrist Dr. Sarah Burns is here to explain the risks and share simple steps to protect your foot health. Thank you for being here.
Thanks for having me.
So, Dr. Burns, how does diabetes affect your overall body and specifically your feet?
Well, everything about diabetes and its complications on your body has to do with the extra blood sugar in our body floating around, basically looking for something to do. So our body can't use that glucose as nutrients the way that it's supposed to. So this glucose starts to attach to different parts of our body and block the normal signals and processes. In the foot, it has the biggest impact on our skin, our blood flow, and sometimes on joints.
Okay, and one of the major concerns I also understand is nerve damage. Can you explain what causes that?
Nerve damage, also called peripheral neuropathy, is because our nerves get glucose attached to them. And then the signals can't pass from the feet up into our brain the way that they're supposed to. The glucose is blocking those signals from passing normally. So certain nerve sensations will be affected differently. A lot of diabetics lose protective sensation, which is this friction kind of sense in our feet. So you might develop problems like calluses and blisters and not feel pain the way we normally would.
Gosh, okay, and what's the difference between nerve, joint, and blood vessel damage?
Yeah, so nerve damage, the peripheral neuropathy we just talked about. Joint damage is a little less common. There's certain types of arthritis and other problems that can cause pain or limited range of motion. And blood flow can also be affected because the blood vessels can become more rigid and not as elastic and more inflamed, which can lead to blockages. And we're not getting enough blood flow to our feet in those situations.
Gosh, okay. And what steps can people take to prevent or at least delay nerve damage in their feet?
To delay nerve damage and really any other complications from diabetes, controlling our blood sugar really is super important. By reducing our blood sugar, our body's function can be much closer to normal.
Okay, and for those already living with diabetes, what are the best ways to really improve and protect our foot health?
Besides controlling blood sugars over time, one of the most powerful things that patients can do is actually institute a daily regimen of looking at their feet, specifically the bottoms of our feet, which can be hard to get to because they get so far away, especially as we get older. So if we can't see the bottoms of our feet, maybe get a mirror and put it on the ground so that we can reflect up to our faces what we're seeing. Or if we're lucky enough to have a loved one who's willing to look at our feet. If you know what normal looks like, then you're going to be able to tell if something has changed. With problems like skin and nerves, what we're looking for is blisters that we don't really understand why they got here, especially if they're changing colors and looking kind of strange. Calluses that are also starting to look strange, getting really large. Those can sometimes hide problems like wounds on our feet, which can become infected.
Okay, and when should we be calling our doctor, though, or scheduling an appointment if we're just looking and we see something that isn't normal? Because sometimes you don't want to be overkill and go too early, but is there such a thing?
There's no such thing as too early when it comes to foot care because everything can look a little bit different. If you've seen a change, then you want to see your podiatrist or your podiatry team as soon as possible. Wounds could take like a few minutes to develop in the wrong pair of shoes or something happens, and it can take months to heal afterwards. The sooner that we catch them, the shorter that time is, and the lower the risk of infection and other health problems.
Amazing. Are there other key takeaways or anything you want to add to for viewers at home?
Also, just as a note, wearing shoes or something with a hard sole around the house is a super helpful habit to have. One of the issues with nerve damage and poor circulation is that you may not feel if you step on something, if someone broke a glass at a holiday party, then you may not notice there's a problem until it's a pretty big problem. So having a hard-soled shoe on your foot can really help to prevent that.
Okay, amazing. Don't be walking around barefoot all the time. Pro tip. Thank you so much, Doctor, for being here today. We really appreciate it.
Thank you for having me.
And if you want to explore more ways Optum Care Washington can support your health, just head to the website that you see right there on your screen.
New Day Northwest is sponsored by Optum.